Thank you. Any questions? Representative Johnson?
Thank you very much. For both of the OB-GYNs that are on the panel, the last testifier is correct. This bill does not include choice provision. It does not include rape or incest or fatal fetal abnormality. This law in this bill is specifically about a medical exception. And we've heard some discussions today, and you've had some of the witnesses who were patients in a case. I read out 3 earlier examples of women at 11 weeks pregnant, almost 6 months and 17 weeks pregnant. Do you believe that if this bill passes, it will give OB-GYNs the ability and the flexibility to treat those conditions at the earliest moment, as opposed to these situations where these women got so sick that they died?
I do.
I think it will help.
And you also mentioned, Dr. Brown, the issue of recruiting. This issue is not just a medical exception for pregnancy complication, but it's about the quality of our healthcare community in Texas and being able to recruit the most talented individuals who feel free from the risk of prison for practicing reproductive health care.
I strongly agree with that. And I have some direct personal experience of people I've trained as a residency program director for almost 15 years. And many of the people I trained that I know called me to tell me they were leaving the state. These were, most of them are women in all OB-GYN programs. It's about 85%. And some left because they were concerned about their personal health, not being able to get the kind of care they needed. Many left mainly because they felt they could not care for their patients that they were responsible for in the state correctly because of these laws. One in particular, I actually called because a reporter wanted to find someone who had left, and I called her. She's in Colorado. She's a woman that I met when she was an intern. I worked with her off and on in rotations through her residency, and her intention, she grew up in Katy, Texas, went to University of Texas, went to UT Houston Law School. She was a resident with me at Parkland Hospital, and her intent until these laws passed she is a third-year resident, was to go back to Katy, be with her family, and take care of all of her friends for the rest of her life. She is now in Colorado, and she will never return to Texas to practice medicine. And that is a huge loss to me, and I'm very concerned about that. And the fear of not being able to care for the patients you're responsible for, as well as the personal risk that is perceived because of the criminalization, is really taking a toll on our healthcare force here.
And while we try to solve this problem of relieving the pressure, again, as we've been told, nobody's actually gone to prison. No physician's actually been prosecuted. The threats alone are enough to curb this behavior. And so you equally understand why we are debating an issue of relieving a criminal threat on this side and not imposing a criminal threat on other people as part of this complex medical discussion.
Yes, and I'm here speaking on my own behalf. In the past, I've spoke on behalf of some organizations which do not support this bill for that very reason. They are very concerned about this 1925 law. And my view is the house is burning, get out of the house, let's fix the fire, and hopefully the fire won't spread to another place. But from the discussion I've heard today, I wasn't really aware of how that could happen. I've learned a lot of legal concepts today, which I had no knowledge of before, for sure.
So we definitely don't want to start another fire.